26 doctors and nurses, 8 hours, and at 12:37 p.m. on September 18, 1974, conjoined twins, Clara and Altagracia Rodriguez, drew their first separate breaths. PR chief Shirley Bonham braced for the tidal wave of coverage, more than 5,000 news stories by the week's end. Inside the theater, Dr. C. Everett Koop murmured a prayer, then turned to his next mission: prove children's surgery deserved its own specialty. From PHI Media, I'm Gordon Thane, and joining me for a conversation is someone who knew Dr. Koop personally and decided to bring his full complexity to light. His new biography is the first comprehensive account of Dr. Koop's life and legacy, capturing the contradictions, convictions, and courage of a man who reshaped public health from the inside out. This is my conversation with Dr. Nigel S. Cameron. You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. Before Dr. Koop was Dr. Koop, and the early childhood formative experiences, in your book you talked about, I think it was very clear that this is someone had a very strong interest in medicine, whatever that looked like at the time of having those thoughts and curiosities, and then ultimately taking the steps to become a doctor. One of the mind-blowing things that I learned from the book is, as a fairly young person coming into this world, you assume that pediatric medicine was something that existed from the beginning of time. And so I had a hard time wrapping my head around how you describe, here you have Dr. Koop, who grew into that role, doctor, felt a calling in terms of caring for children, and then having to be the person to pioneer even the field of pediatric medicine in the first place. That was very difficult for me to wrap my head around, that this is a fairly new field within medicine. So can you talk us through that part of Dr. Koop's journey from getting to that point?
We find it hard to understand quite how rapidly medicine has developed in our lifetimes, your lifetime, my lifetime, and how different things were. That's the background. So, for example, and Koop talks about this, back in the 1920s and 30s when he was a kid, a lot of surgery was done at home. Mm-hmm. So, for example, if your kid had get the tonsils out, you would not be doing this in a clinic. Mm-hmm. The doctor would come round and do it on the kitchen table, maybe in the bath, catch the blood, no? And for an anesthetist, anesthesiologist, these various terms used, mom would do that. Or maybe there's a neighbor, and she'll come in. Mom finds it a bit scary. Neighbor will do it. The doctor will say, here, well, you just pour this. And that was how things were when Koop was a kid. And he says that when he had, it was his appendix or tonsils or something done, his dad was criticized because he actually went and found a professional anesthetist. This was an extravagance. So you're talking about a very primitive medical situation in general, and also one in which children are not taken terribly seriously. And it's a curious thing, really, business, market sort of terms, because children get sick so much.
Right.
An awful lot more than they do now, because we didn't have a lot of vaccines and so on. It's a great market, and you've got a whole lot of sick kids around. Physicians didn't like treating children because they were just difficult. How do you make sure? Koop says somewhere that physicians didn't like anesthetizing kids because they didn't know they could wake them up. It was pretty haphazard, and one of the major impacts Koop had was in really developing pediatric anesthesiology. That's another discussion. Things were pretty primitive back then, and they were especially primitive for kids. Now, interestingly, the UK was in the lead in pediatric surgery, pediatric medicine more generally. And Koop, one reason why Koop came over to the UK a lot during his professional life. But when he started out, back in late 30s, the 40s and so on, very, very primitive. And at the time when he started at Philadelphia, the Children's Hospital, he reckoned he was one of perhaps only 4 full-time pediatric surgeons in the United States altogether. And it was around that 4, 5, 6, difficult to tell. And there were one or two who were almost full-time, but did a little bit of other surgery, so they didn't count. But this was a big discussion. But he was one of the first handful of actual full-time pediatric surgeons. And this is because his boss at the hospital in Philadelphia, he said he had his project. He said, okay, I want you to do this. You're a bright young person. Focus on pediatric surgery, and you must just do it 100% of the time. It was a package. He actually wanted to get into cancer stuff. This guy said, no, this is what I'd like you to do. And so he did it that way. And this made him obviously one of the pioneers. He then went to study in Boston, because Boston Children's Hospital was the top place for pediatric medicine. And he studied with a man called Ladd, L-A-D-D, Ladd, William Ladd, who would be regarded as the father of pediatric surgery in the United States. And he was then just retiring. And he had a number two, a man called Gross, who became quite friendly with. But these were the guys. So he went and spent a few months with them. Then went back to Philadelphia and set up shop on his own as the boss. But this is in the mid-40s. And these were the first people. And there were 2 or 3 dozen children's hospitals in the US, called children's hospitals. But hardly any of them had full-time surgeons. It seems bizarre. And so you would get general surgeons at the Children's Hospital of Philadelphia. When he first got involved, there were 4 general surgeons working in the community who were kind of on call and would come and do children's surgery, what Koop later wanted to call pediatric surgery, but it was then typically called children's surgery, child surgery, as part of what they were doing. And Koop said, this isn't the way to do it. We've got to focus full time. And then we've got to get people with subspecialties and so on. And in a sense, his key role in the profession was in developing a pattern in which there was a whole range of 8, 9, 10 subspecialties of people who were primarily pediatric surgeons, but then were focused within that on neurology or renal or whatever it was. And he built that team out during his time at the Children's Hospital, and it became the pattern for what people do everywhere.
When Dr. Koop joined Children's Hospital of Philadelphia in 1946, there were maybe 4 full-time pediatric surgeons in the entire United States. In 1948, he helped found the surgical section of the American Academy of Pediatrics. Formal board certification wouldn't come until 1975, but the template was set. Talk to me a little bit about, there were some fascinating examples of the types of surgeries that he was involved with as a pediatric surgeon, and even some controversy around that. I think there was a example that was referenced about conjoined twins and the surgery to separate them. That was prior to his time as Surgeon General of the United States. I think in the way that you framed it, one of them would die from the surgery. So pediatric medicine was a controversial thing. Operating in a case where one child's life would end also has some inherent controversy there. What were some of his experiences, other experiences that he had to go through like that kind of shaped him in his conviction going forward?
Koop hit the headlines several times back in the 50s, 60s, 70s, when he operated on Siamese twins, as we used to call them, conjoined twins, as the technical term is. We call them Siamese twins because there were 2 very famous Siamese twins who were Siamese in America in the 19th century, and they were circus performers. You have children from time to time who are born joined together. And he operated on probably about a dozen of these cases, maybe a little more than that. But 3 cases were celebrated and became very public. In one of the cases, there were 5,000 different newspaper, magazine articles around the world about the case. It was a huge thing. And, of course, the hospital became very famous, and this was something got Koop into the press, which something hadn't happened to him before. People are fascinated by this whole notion of a conjoined twin. And they were different cases, and none of them went perfectly well for various reasons. In one case where there was a separation and both the children survived and did well, the little girl choked a year or 2 later, got choked to death eating beans. And he went over at the funeral. Anyway, but the most difficult case was one in which it was a Jewish family. And the grandparents were rabbis and very serious Orthodox Jewish context. And there were these 2 little girls they could not both survive, but they would both die.
Right.
Unless one of them died sooner than the other, as it were. Koop said the children's grandfathers were both rabbis, and they insisted on having several days of rabbinical debate to argue out whether it was the right thing to do, to intervene in the case of these two children who were joined together. Koop said it took him 15 minutes to decide what to do. He said, either we have two dead children or we have one dead child and one live child. And he said, for me, that was very simple.
Dr. Koop called separating conjoined twins not the hardest thing we do, just the most spectacular. His secret was in the dress rehearsal, run the whole operation 3 times before the first incision. But 1977 tested even him, twins who shared one heart. One child had to be destroyed to save the other, he told the LA Times. He would later call it the hardest day of his professional life.
But he said, I knew I would have to be the one who killed the other child. And he said it was huge controversy. A lot of the nurses were Catholics. They were horrified by this. Koop was pro-life. He was going to kill a child. But he said, I killed one of these children or they both die because the heart was not strong enough to sustain both these little girls. And so the rabbis finished their debate. They approved what was to be done. And Koop performed the surgery. The weaker of these little girls, he snipped, removed connection with the heart. And this little body was then carried out by a nurse out of the theater. And there was a rabbi waiting to take her for burial. And then they fixed up the other child. And tragically, the child died a few weeks later of, I think it may have been an issue with a blood transfusion or something. It wasn't to do directly with the surgery.
Right.
But there was huge ethical debate about this. And in fact, a journalist from Philadelphia who had written a piece that was nominated for a Pulitzer about the experience in the first place was also a playwright. And many years later, when Koop was, after he was remarried, so this would have been when he was maybe 94 or something like that, wrote a play based on what had happened. And Koop and his wife were driven down from Hanover, which is where they live, New Hampshire, to Philadelphia to watch the play and to talk about it afterwards. It's a very moving scene, as terrible ethical dilemmas involved were laid out in the context of a play by the journalist who'd been there way back and reported on the event. But Koop became TV-type celebrity through these Siamese twin operations. I think he rather liked that. And he wrote, interestingly, and there's a bit about this in the book, but he several times thought about writing an autobiography. He has a sort of political memoir that was written after he stepped down, but earlier on, and one of them must be 40, 50 pages, all about one of these twin separations, and it's all there in the files. It was never published. Right. But he was fascinated by these experiences. He said they weren't the most difficult pieces of surgery he did, but they were very complicated because you had to have lots of different people involved doing different things. And of course, you had 2 sets of things going on. And but I think he found these very fulfilling exercises. When he also liked publicity, he quite enjoyed being a big man, and he was.
And there was another component of him that I wanted to explore around advocating for children with disabilities, and so that's another thing too that I'm fairly new to this world, I think, and hearing this idea of children being denied surgeries because of a pre-existing disability, and how very passionate Dr. Koop was against behaviors like that and taking things in his own hand, getting legal involved. Can you talk through that, an example that kind of reflects that side of Dr. Koop?
He was a ferocious campaigner for things in which he believed for the rights of those who were disabled. And he was horrified by the idea, and this was a very common idea back in the 50s, 60s, that a handicapped child is better off dead. There was a very famous article written by 2 academics at the time talking about a series of cases in a hospital, a children's hospital, where children had died because of the decision taken that they would not be operated on and they would not be fed. And so they died. And this was the kind of public conversation. I mean, these guys were not prosecuted for doing this. This was regarded as one way of handling children who have these problems. And Koop was quite ferocious in that he would never accept the child who had the capacity to live, even if there were physical deformities, even if there were mental problems, that this child should be disposed of.
In mid-century America, some hospitals simply let disabled newborns die. One baby with Down syndrome was put in the corner of the neonatal intensive care unit and not given any nutrition. Dr. Koop would have none of it. In his surgical handbook, he insisted, "Do an even better operation for the handicapped child. They deserve it and need it." And because some parents still walked away, he founded an adoption and child service agency to make sure every infant got a chance at life. Those convictions would erupt later on the national stage as he made his way to Washington, D.C.
At one point, there's a quote where he says that he doesn't think parents should have the right, have the discretion to kill their children. And he had this commitment. And there are some very moving stories where he discusses the extreme handicaps of children who were presented to him, with limbs which were 2 or 3 times the normal size of this and that. But he has a story that brought tears to my eyes of a lady coming to see him with 2 little children, healthy children, with one who has some severe abnormality. And he says these were really poor people. These were poor people back in the 50s when poverty was even bigger than it is now. And he said the woman was wearing clothes which was held together by pins and that thing. And she said to him, "I want this child to be treated even better than my 2 normal children." And that was exactly his view. And so at one point where he's talking to his residents and so on, he says, the handicapped child deserves a better operation than the normal child. And one of his patients, whom I spoke to and interviewed for the book, I don't have the number in my head, had, I think, something like 25 different surgeries.
Wow.
Over many years. And Koop performed the first 15 or so of them. And the parents came to him with this child. He was born as a baby. Innumerable things go wrong. And Koop said that every single one of these problems is correctable by surgery. It will take years to do this, be very uncomfortable, and be very this, that, and the other. But he said they're all actually correctable problems. This is what you want. And I interviewed this man who's now in his 50s or so, and had a career in insurance or something like that in the end. Just delightful man, and very happy to have his story told in public. But he said he had maybe 15 of these surgeries, and then Koop became Surgeon General. He retired as a pediatric surgeon back in 1981. And he was very anxious because he would now have another physician operating on him. And he was being prepped for surgery, and he was there on the gurney waiting to be wheeled in. Who comes in through the door? But the Surgeon General. Koop has gone on a train in his uniform up to Philadelphia from D.C., and he says, "I can't operate on you because I'm not doing that now, but I could push you into the theater." That's the kind of guy Koop was. And he had this guy was a heavy-going social conservative in every conceivable way. And yet, back in the 40s, he is going out every Sunday night till after midnight, many nights, leading a team of students working with the people living on Skid Row in Philadelphia. He has a huge fight when he's a young doctor, had surgery and so on, in the Children's Hospital of Philadelphia, by admitting a black child to the private ward, which was only white. People, nurse resigned and so on because of this. He was ferocious in his support of Jewish physicians. And it's hard to remember now, but back in the 50s, 60s, even 70s, I mean, anti-Semitism in the US was very powerful at high levels. So he had one physician he knew who'd applied for a job at a children's hospital out on the West Coast and went out for the interview. And before the interview, some person said, "Excuse me, can I have a word with you?" and took him into a private room and said, "Just to let you know, thank you for coming, but you'll not be getting the job because we already have our token Jew. But we'll go through the interview process and very glad that you could join us," and so on and so forth. So he goes back and tells Koop. Well, Koop, of course, is livid. Koop writes to the hospital board. And the hospital board write back and say, "Mind your own business. but the guy got the job. So, I mean, here you have on anti-Semitism, on racial question, on handicap issue, this guy who is this heavy-going social conservative has this full-throated commitment to the rights of people who are on the outs. And it's very powerful. And Koop had his problems, one of which was his ego. But he so often used his enormous energy and personality and sense that he knew the right and the wrong for people who really were not typically helped by social conservatives at all at the time. And at the center of this was his commitment to those who were handicapped. And I've got a great quote from a guy who was the president of the Institute of Medicine, which was this big academic overarching organization, who says that what made him the best pediatric surgeon in America was that absolutely nothing would come before the interests of the individual child. And he wasn't anyway concerned about money and prestige, about the risk of this going wrong, and so on and so forth. It was, here we have a child, these issues are correctable, and therefore we will pull resources together.
And then he became Surgeon General. Late nights on his New Hampshire farm, Dr. Koop replayed every case. He recalls never having a former patient of his come back and say they never wished they were born. And this is something that shaped his perspective of the world and how he practiced medicine. Coming up next, that conviction follows him all the way to Washington, D.C., where he became the 13th Surgeon General of the United States, taking on big tobacco, HIV/AIDS, and a whole host of other public health and social topics. That's next time on the Public Health Insight Podcast. This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.